Thank you very much for having us here, and I want to recognize and thank the team, Inder, Makin, and Ryan Hutman. It was a great collaboration, and I want to thank the Spark Tank and everybody involved in that for helping to support us in our project. And we're really excited because this is just the start of our initiative. So our goal is to really enhance the capabilities of ultrasound in the classroom. And in order to do that, we really needed to build some infrastructure, which is pictured here, so that we could display it to large audiences and be interactive instead of all huddling over one ultrasound unit. So with the money that we received, we said that we would achieve 3 main goals that are listed here. And I'm going to go through each of them today. So the first thing was that we were going to build the mobile picture-in-picture system, integrate it with the ultrasound unit. And this is where Ryan Hutman's expertise was invaluable to this process, where we configured and procured the AV equipment needed to set up this system. So here you can see the system pictured. We purchased an AV bridge that takes the output from the ultrasound unit and from this camera and puts it onto a laptop computer that's then projected to the classroom. So we purchased this laptop that can work with high-speed video and large files, a camera on a tripod, and then we already have the ultrasound units here through some funding that Dr. Makin and Heath and Soma have procured. So again, this is what we're trying to teach students, how to use a scanning probe and interpret the image on the ultrasound unit for visual feedback and learning manual skills, for learning anatomical structures in a different modality, as well as moving toward diagnostic purposes for those professions who are able to use it in that capacity. But as you can see, this is not very feasible for a classroom of 100 students. We then were able to use our equipment to create an image like this, so we're simultaneously seeing the ultrasound scan where the probe is being placed on the patient or the model, and then the image that it is generating. So this can occur, as you're seeing here, in a real dynamic setting, and helps with instruction and the quality of it. So we built that infrastructure, and then we were going to develop, we proposed 1 learning module in an athletic training class. Over the several months, we've been able to integrate this system in several different capacities in 4 different learning settings within the athletic training program, of which I'm affiliated, and in the Soma OMS class to do abdominal scanning. So we were really happy that we've been able to integrate this further, and tomorrow afternoon we will be doing another session where we're integrating the system. So this is an ongoing initiative that we just are excited to replicate and continue building. So what did a learning module look like? And this was our initial steps in developing a learning module, but again, we have plans to further refine this. But the students, before they came to class, were asked to do an assessment so that we could then compare to our post-assessment and have some data to present to you today. They also were asked to watch some videos so that they were familiar with the technique, what they were going to be oriented to, as well as read some articles that were relevant to the clinical topic so we could tie it back into practice instead of just learning a skill and not being able to see the relevance of it. So when we got into the classroom, we would do a brief lecture. Dr. Makin would talk more about the ultrasound characteristics and imaging techniques. And again, we feel that this is really important because we can't just make robots. We want to have informed users about the equipment in which they're using instead of just learning how to scan. And then I would talk briefly about the application of the skill that we were going to learn that day within, for this instance, the shoulder motion in athletic training and how to interpret that. We would then do a demonstration of the ultrasound, and so I'm demonstrating, and being projected is this picture-in-picture image up on the projector, and Dr. Makin is able to do some instruction with the students, so it really makes for a very good learning environment. The students then do some hands-on activity. They take some measurements. They see how they're learning this skill themselves now that they've had some learning module activities. They've had a demonstration. They're now allowed to experience it themselves. And we have a nice number of units to be able to distribute and do that. We then follow up the class with some discussion about the application of what they learned and what they did or didn't like. And then within a week following that learning module, ask them to complete an assessment. So, or a reflection activity, so that we could see, is this learning module effective or do we need to make some changes? So that leads us to the third goal that we proposed for this project, which is assessing student knowledge and perceptions of this ultrasound integrated into their curricula. So we assessed it on 4 different levels, and I'm going to show that to you now. So we looked at what their instrumentation knowledge was. We looked at a variety of domains about the characteristics of how to use the probe, how to hold the probe, how to interpret an image, and what was really happening. And then, as you can see, pre versus post assessment, the students were able to answer the questions more accurately and correctly. So again, our learning modules, where our brief lecture in the classroom targeted those assessment types of information, were effective in improving their knowledge that they were able to retain for at least a week after that when they took the post-assessment. We also looked at their ability to interpret and apply the ultrasound findings. So one example is to look at an ultrasound image and be able to identify the different structures anatomically based on what they know of both anatomy and the appearance of echogenicity on an image. They were also given a clinical scenario, and this is the example that we gave them for the shoulder motion, in which in the lab we measured this measurement called humeral torsion, and they had to then use that to calculate some parameters and then interpret that and make a clinical recommendation upon that. So what we found was that following the learning module, their interpretation accuracy and the effectiveness to be able to apply these ultrasound findings improved following the learning module. What we all really want to know is how they perceive this, right? So from how to actually use the ultrasound, scan, and probe, to what they perceive it meaning within their education and clinical practice, we found that their perception improved. So as we continue to integrate the ultrasound into the curricula, expose the students to this, we believe it will continue to improve both their ability to use it, apply it, and improve their overall clinical practice into which they're delivering to patients. Recently, I took this into an athletic training lab where they were assessing ankle motion and some special tests for that, and I asked them for some more qualitative reflections of that. And so, again, just highlighting some of these, they said the ultrasound really helped me realize how little movement there really is at that joint. It was very helpful. It allowed me to visualize the effect of the test, whereas before I was only able to feel it. So it really helped me understand why we do this. This is always a helpful tool being integrated into our labs. It allows us to visualize what we normally only feel. It gave me a new appreciation that I wasn't able to have before. So students are really able to value the ultrasound and its ability to provide visual feedback in this instance, and also a better understanding whether it is of anatomy or of a clinical skill. And with that, I'm going to turn the mic over to Dr. Makin, who's going to talk about some of our future plans.
Thanks. So it's great to come at the end and show the last slide. So that's me here. So I want to, that's us, and I just realized looking at that picture, I'm wearing the same shirt. It's not an advertisement, okay? But it's washed in between. So I want to go through this real quick. I do have to use the mic. Okay, I won't shout. So there are 3 buckets of this work that can be carried on. And one is to collaborate. One is to develop and one is to disseminate. So I'll go through down these columns one by one and try to explain to you. So by now, it's well known on both campuses that ultrasound-based modules can advance medical education. We can talk about that offline if anyone has doubts, but we have taken that first step at SOMA, and with this grant, it has enabled us to actually take this further. And so the first bullet, IPE, is really a focus area with this collaboration between, first of all, let's look at the three people involved here. There's an IT expert, there is an athletic trainer, and there is me, who's a jack of all trades. So right here, you have an interdisciplinary group that is trying to do something between schools, okay? And it's related to athletic training education, but with ultrasound in mind. And that can be applied to an interprofessional environment. And what I have learned, despite the experts that are here, are those 3 R's in IPE that I kind of understood based on the presentation. So one is respect for other professional groups within the healthcare team. Second thing is to recognize what they do. So that's the second R. And then the third one is to deliver, basically, to deliver quality care, healthcare. And that's what our students are going to be doing, you know. So that's the 3 R's that I go by. We, in collaboration mode, we are working with athletic training. I mean, we are working as we speak, and we're going to build these modules further. We've already introduced this in human anatomy in SOMA. We're working with Dr. Crutchfield and team. Of course, we have a big grant related to dissemination of this within the osteopathic program. These are extensively being used. We have student clubs. In fact, tomorrow's lecture that Dr. Kellie mentioned is a surgery club at OMS 1. And we're going to talk about the use of ultrasound in a surgical environment. So this is collaboration downstream, actually, this being the header, really. And then last but not least is student research. Especially in the SOMA environment where we are limited by the OMS 1 being here physically. And then they leave us, so to say, physically. This is an excellent vehicle to actually do research that is not the mad scientist Frankensteinian research, but real teaching-based research. And I think we can incorporate that in OMS 1 environment and of course beyond. Okay, so then the second column here is to develop. So clearly what we have shown you, Dr. Kellie, what she has shown you is a beta version of a teaching module and how to implement it. It came with a very simple idea, but we have implemented it anyway. And we're going to replicate and refine it, of course, so that we can use it over and over again. In fact, we're going to build a similar system for the SOMA group, you know, and so that we use this only within SOMA. Okay, we can expand the development of learning modules focusing on point of care. Again, whether it's internal medicine, med skills, surgery, and so on and so forth. And that's only in medicine. It can go into dentistry and so on and so forth, athletic training, physical therapy, etc. And then this is kind of the key is, what good is it? I mean, this is a GWiz thing. It's a new gizmo. Well, what does this teaching technique lead to? Does it increase competency? And I know that you know, there are academics over here who would really question that. And we are prepared to prove that there is improvement in competency eventually, okay? Within their educational curriculum, hopefully, not beyond their residency, okay? So lastly, dissemination within ATSU. I've given you some examples, certainly being implemented very actively in SOMA because of my involvement there, because of my work with Deborah Heath and the anatomy folks, athletic training educators, and clinical anatomy, of course. And we have this workshop accepted at the Athletic Training Education Conference next February. So we'll be traveling there and giving them a workshop, basically, on this with an example of shoulder assessment. Okay. So thank you very much for your attention. And I'm using this old-fashioned stuff, but any questions?